Hi, this is Ed O'Brien, and I will be talking about computer-assisted instruction. Computer-assisted instruction is also known as computer-based learning or computer-based training. It is a technique using interactive instructions with program materials presented by and monitored with the use of a computer. It is becoming an increasingly popular way to provide education with improved computer literacy throughout the population. Computer-assisted instruction promotes learning predominantly through the cognitive domain and can enhance the development of critical thinking skills and problem-solving techniques. There are a variety of ways that computers can be used for teaching purposes. This includes simulation, problem-solving games, tutorials, drill and practice, and discovery. Computer-assisted instruction can be used in conjunction with traditional teaching methods, like in blended learning programs, in isolation, like with online learning programs, and can be used throughout the entire continuum of learning from early childhood through professional education. There are many advantages to computer-based learning. Research has shown that computers can actually enhance learners' comprehension and retention through illustrations and audio content. It allows the learner to work at an individualized pace. It also provides privacy, which is helpful for shy or slow learners. Computer-assisted instruction can provide immediate feedback to both the learner and the instructor. It also allows for self-directed learning, letting the learner move more quickly or slowly based on their preference and/or ability. It is time efficient in that it allows the instructor to develop the curriculum. It is not time sensitive in that the curriculum is readily available and accessible to learners. Despite the advantages of computer-assisted instruction, there are some disadvantages as well. Teaching administered through the use of a computer can seem mechanical instead of personal. As opposed to a classroom setting, computer-based learning can lack in an infrastructure, which is not well suited to poorly motivated individuals. Oftentimes, computer-assisted instruction uses multimedia modalities which could actually distract the learner from the content that is to be learned. It also requires computer literacy, which is becoming less of an issue as more people are becoming familiar with technology and using computers. It does require access to a computer, and not everyone has a personal computer. In addition, some learners may have physical barriers preventing them from making it difficult to use a computer for learning, like arthritis, visual deficits, or paralysis. There is also the associated expense for hardware and software, which can be expensive. Computer-assisted instruction is very useful in healthcare. It can be used in education for medical students as well as continuing education for physicians. Research has shown that online modules teaching physical exam skills was useful for improving clinical skills. Another example is using online simulation. MedSim includes case simulations in which a medical student interacts with a virtual patient to get the patient history, conduct a physical exam, determine a diagnosis, and make treatment decisions. Using a computer, the student may ask questions to the virtual patient, order medical examinations or therapy activities, and determine the outcome. The student works his way toward a correct final diagnosis. The student's decisions have direct consequences on the virtual patient's treatment outcome. Another example is SuperCourse, a public health and epidemiology database supported by the World Health Organization that offers 200,000 lectures in 33 different languages. The American Medical Association also offers online modules for continuing medical education. Computer-assisted instruction can also be in nursing education. This course serves as one of many examples. Online nursing education can be used in blended programs where there is some face-to-face classroom teaching paired with self-directed online learning, or online programs like this one for RN to BSN programs. In addition to BSN programs, there are master's and doctorate programs that are offered as computer-based learning programs. Petty states, interactive self-regulation and/or testing can be a valuable learning strategy that can be incorporated into self-directed programs of study for post-registration learners when discussing technology-based education. Computer-based learning can also be used for employer-based continuing education and competencies. Examples of websites offering nursing-based education include Medscape and Nurse.com. Computer-assisted instruction can also be used for patient education. There are a multitude of websites that provide educational materials for patients. Content can be taught using videos, interactive modules, and tutorials, graphics, and printed information. Topics include conditions and diseases, procedures, diagnostic tests, medication, prevention, and wellness. There is also content available for addiction, mental health, death and dying, and bereavement. Many websites offer the content in Spanish as well, with closed captioning. Research has shown that using telemedicine technology to do patient teaching is as effective as doing live teaching with patients. One study found internet-based instruction to help increase education and change high-risk behaviors in a hard-to-reach target population. Computer-assisted instruction is an increasingly popular way to provide education. It is useful in the healthcare for patient education as well as for healthcare providers. While there are some disadvantages compared with traditional classroom instruction, there are also clear advantages to computer-based learning. Thank you for listening to my presentation. My references are listed on the slide that follows.